Hi everyone. My poster is on medication errors and the prevention of medication errors. Let's start out by defining medications. Medications are chemical substances used to treat, cure, prevent, or diagnose a disease or diseases. Medications are vital to our role as providers. The purpose of this literature review and poster is to evaluate the effectiveness of the application of medication error strategies in preventing medication errors. This means ensuring accurate prescribing, dispensing, administering, and also educating patients in order to prevent medication errors and to ensure patient safety. The most common medication errors are not double checking medications before administration, not having or not using an EMR when administering medications. Interruptions during medication pass is also a cause of medication errors. Not implementing audits with feedback also lead to an increase in medication errors. And lastly, not following the 6 rights of medication administration. The 6 rights of medication administration are the right patient, the right medication, the right indication for use, the right dose, the right time, and the right route. My research question for this poster is, in healthcare providers, how does the application of medication error prevention strategies compared to no application of medication error prevention strategies affect medication error rates? When searching for information on medication errors in order to complete this poster, the databases I used for information were the MAG Library, PubMed, CINAHL, and Medline. The keywords I used in searching for information or medication errors, prevention, reduction, and medical providers. I had chosen 4 systematic reviews and 1 cohort study. From reading these scholarly articles, the positive results I found were that there was positive feedback on the use of prevention strategy application, that these concepts can be used for the administration of all medications, and that the use of prevention strategies actually decrease the rate of medication errors. When it comes to project implementation, I found that stakeholders, barriers, and facilitators of change face many issues when it comes to medication errors, such as patient and family factors and health system factors. Some examples of health system factors are type of facility, type of payment mechanism, level of services, definition of client, and also the types of providers. As healthcare providers, we can use clinical practice strategies when dealing with any and all of these issues. Clinical practice strategies for improving medication safety are as follows. For providers, please double check all of your medications prior to administration. Always use the 6 rights of medication administration. Always use the do not interrupt practices, plus implementing an audit with a feedback. And lastly, always use the EMR when administering medications. When teaching patients and caregivers, we as providers need to stress and educate them on the importance of not sharing their medications with others, reporting any adverse reactions to their medications, following dosage instructions, And also, we need to educate them on the importance of completing all of their medications as prescribed. In conclusion, all of these studies showed a decrease in medication errors. A future plan would be to implement one or more of these strategies into daily routine. I could not stress enough the importance of medication safety as a critical component of healthcare, affecting patients of all ages and of all backgrounds. Implementing the use of these practices can ensure proper medication use and prevent adverse reactions, hospital readmissions, and even in some cases, death. As healthcare providers, it is our responsibility to prioritize medication safety, and by doing so, we can help prevent medication errors and also ensure that our patients are receiving the safest care possible. Remember, medication safety starts with you. Thank you for your time. The 5 project questions that I would like to pose to you are: 1. Can you identify the top 3 items, ideas, concepts learned from the presentation? 2. Discuss how this information may be applied to your practice. 3. How do interruptions during medication passes increase the risk of medication errors? And can you give me some examples of these? 4. How does the EMAR help to reduce medication errors? And finally, 5. How do behavioral methods such as double checking help to prevent medication errors?